My name is Koberstein. I'm a radiologist at MIC since 2015. I'm a general radiologist, so CT, ultrasound, and then a little bit of an interest in breast imaging, so the mammograms, ultrasound, MRI, and a lot of breast intervention procedures. So that's my main role. I grew up in Barrhead, Alberta, which is an hour away from here, and so after high school I came to the U of A and I did all of my training at the U of A. I would have liked to have gone away, but I was going home on the weekend to help on the farm, so I just did everything here. I did 3 years of undergrad, so I never really got a degree, but then I did med school, and then I did the residency program here, and then I started right after that. All I wanted to be when I grew up was a farmer. Like, I grew up and that was the only thing I wanted to be, was a farmer. My parents kind of kept pushing me and kept making me, they're like, we won't let you just stay on the farm, like you have to go get an education. So I was a farmer or like a hockey player, but it became clear that that wasn't going to work out. My path to radiology from within medicine was a bit more a clear moment when that was what I wanted to do. I had never heard about radiology. I didn't know anything about it going into medical school. And I went and worked at the Grey Nuns with Pusnak, with Dr. Pusnak and Dr. Bruce. And I was like, these guys are cool. This is a pretty fun job. And so we kind of planted the seed. And then, when I did the rest of my rotations, I was interested in emergency medicine and surgery, but it was always the imaging that was the best part of it for me. And I was the most interested in that part. So I had to change all my plans. And Dr. Fung helped me get in on a research project. And Dr. Abley, I did some nuclear medicine research with him and was able to pull things together in order to do this. And I can't even imagine if I'd have gone down one of those other paths. Like, this is definitely I'm very happy that I found radiology. So. My mom would always roll her eyes when, she's like, I always remember you were a little kid, and just a little kid, and you asked me, like, how does a motor work? And she's like, I don't know. And she's like, you were just disgusted with me. Like, how do you not know? Like, how are you not interested in that? Like, how does that not, like, you're okay driving this car, like, not knowing how it works? And so I think certain people just are like that. They want to have that knowledge. And medicine and radiology in particular, I think that's a really key part of it, right? Just wanting to know what's inside, how does it work, what are the, kind of the inner workings of this. The most interesting cases in the hospital come to you. These are the patients that need you the most, and it's the most interesting stuff in the hospital, right? So it's the kind of the hardest conundrums and most unusual things. And so I definitely think that is the most fulfilling part, is that when you get to use some knowledge, when you can kind of make one of those interesting diagnoses or find something maybe unexpected, but it's going to have a big impact for somebody. I went to a pretty small high school. I didn't do IB. I didn't study in the evenings. I wasn't trying hard at school. I just wanted to play hockey and be a farmer. And first semester of undergrad, I remember doing the first midterm exam, and it was organic chemistry, and it was in like this really big class of like 450 people. And we had a pretty famous professor, Dr. Veteris, and he had a tradition where he was like, I always get the person who gets the highest mark to come down and hand them their exam, like, after, right? And me and my friends were in the back just kind of messing around. And it was my first exam, and I remember thinking, these people are from the city, and where am I going to fit? And so I remember then he called my name and wrote it on the board, and I had to go get my exam, and it was like, okay, I guess I can do this. So I think it's just realizing that other people aren't that much further ahead of you. It doesn't matter what your background is. If you just work hard, and I guess the expectations you set for yourself, you can do it. You're a lot closer to where other people are than I think you think you are. So.